afternoon, and thank you for joining us for our discussion on pediatric residency programs. Today's webinar is sponsored by the HMS Harvard Medical School Office for Diversity, Inclusion, and Community Partnership, DICP. The mission of DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, ensure equity in health locally, nationally, and globally. DICP efforts support the career development of junior faculty, trainees, and students, identifies and trains leaders in academic medicine and health policy, and provides programs that address crucial pipeline issues. Today's program is the third webinar in our 2021 Visiting Clerkship Program webinar series. For 30 years, the VCP, Visiting Clerkship Program, has been a model of excellence, offering outstanding medical students, particularly those from groups underrepresented in medicine, an opportunity to participate in externships at Harvard Medical School and its affiliated hospitals. Since inception, over 1,500 students have rotated through the Visiting Clerkship Program. This program has been drastically impacted by COVID-19, and we recognize that there's a lot of uncertainty in what the upcoming application cycle for residency might look like. With this concern in mind, we are hosting a series of webinars to bring the members of our HMS residency programs and medical students together to share ideas, provide support, and address questions on transitioning to the next phase of medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding away rotations, as well as other concerns that students might have. As we begin, a few housekeeping notes for today's session. Chat will not be available. Your microphones will be muted. You can use the Q&A to post any questions to panelists, and this webinar is being recorded and will be posted on the DICP website. It's now my pleasure to introduce Dr. Alden Landry, who's an emergency medicine physician at Beth Israel Deaconess Medical Center, an assistant professor of emergency medicine at Harvard Medical School, and assistant dean of the Office for Diversity, Inclusion, and Community Partnership at Harvard Medical School. He'll be moderating today's program, and I'd like to now turn this over to Dr. Landry. Thank you.
Thank you, Dr. Reed, for that introduction. And thank you all for joining us here for another webinar on our application series as we discuss opportunities for training here in the Harvard affiliated hospitals. I'm really excited about this one, mainly because we're talking about the specialty of pediatrics. We have two amazing program directors who are going to contribute a lot over the course of the next hour. I would encourage you all to be engaged, ask questions, use the Q&A session. I want to make sure we address as many concerns that you all as students may have as we go through our conversation and talk about the residency programs that are two amazing pediatric programs affiliated with Harvard. So I don't want to hold up too much because I know we want to hear from our program directors. And so I'll introduce them quickly. I'll turn it over to them to just give us a bird's eye view of their residency programs. And then we're going to drill down a little bit on some specifics about their residency programs, discussing everything from getting to know the program all the way through the interview process and what that may look like. And really maybe talking about some other issues related to the culture and climate of Boston and the experiences of their residents here at the training programs. So first I'm going to introduce Dr. Theodore Sectish. He's the program director for the Boston Combined Residency Program in Pediatrics. And also we have Dr. Katherine Sparger. She is the associate program director at the Massachusetts General Hospital for Children Pediatric Residency Program. And so Ted, I'm going to turn it over to you so you can talk about your program first and tell us a little bit about what makes the Combined Residency Program in Pediatrics unique.
Sorry, I was muted. Thanks, Alden. First of all, welcome, and it's my pleasure to be here today to tell you about the Boston Combined Residency Program in Pediatrics. First, let me start with the aims. We want to provide you with world-class training and develop you as the next generation of leaders who will transform care delivery, science, and health systems. We want to cultivate a learning environment that reflects a commitment to exceptional care, respect, diversity, inclusion, and your personal and professional well-being. Now, we're a large program, but we're not the largest. What I think distinguishes our program is our ability to individualize your training and help provide you with the most outstanding personal and professional development to launch your careers. We have 2 tracks. We have multiple combined training programs. And one thing that is interesting is that we've trained more residents on research tracks sponsored by the American Board of Pediatrics than any other pediatrics program in the country. Our latest initiatives are, number 1, to promote diversity, equity, and inclusion. First in our recruitment efforts, and I'm proud to say that for the first time, we've had the largest proportion of underrepresented medicine interns we've ever had. It was 20% in this last season. Secondly, we're promoting anti-racism curriculum with our Diversity Council. We're doing upstander training this week for all of our residents, and we're trying to mitigate unconscious bias in both the evaluation process of our residents and the selection process as we recruit new interns. We're at the cutting edge of some educational innovations in behavioral and mental health, primary care, and teach. I sincerely hope that you'll visit Boston Combined Residency Program by participating in the Visiting Clerkship program, and you'll get to know not only our program, but the culturally rich city that is Boston. I look forward to meeting with you and answering your questions today and in the future. Thank you very much.
Thank you, Dr. Sectish. And I'm going to turn now to Dr. Sparger at Massachusetts General Hospital for Children.
Thanks, Alden. Hi, everyone. As Ted said, it's a pleasure to be here with you today, and we're thrilled that you're considering a career in pediatrics. I'm Kate Sparger, and as I said, I'm originally from the Midwest, and I'm a neonatologist by training, but please don't hold that against me. I'm one of the associate program directors for the Pediatric Residency program, as well as site director for the combined neonatology fellowship program. As you may know, Massachusetts General Hospital is one of the oldest teaching hospitals affiliated with Harvard Medical School. And Mass General for Children is a pediatric hospital that's set within the larger academic medical center. The residency program itself is not as large as the BCRP, but it falls in sort of the upper middle size programs across the country. Typically, we recruit 24 residents per intern class, including 13 categorical pediatric residents, 4 med peds, 2 child neurology, 2 child psychiatry, and then typically 3 one-year preliminary positions for residents who are interested in careers in dermatology, radiology, anesthesia. And we really value the opportunity to be part of multiple integrated training programs and feel that it very much adds to the diversity of backgrounds and experiences, as well as the richness of discussions around patient care for pediatric patients. In addition to MGH, our residents spend time at some of our community partners, including Newton Wellesley Hospital, Cambridge Health Alliance, and Brigham and Women's Health Hospital. And we'll talk a little bit more about that and over time. I think it's helpful to share the mission of the residency program, which is I included on this slide, which is to develop independent, innovative pediatric leaders throughout education and personalized mentorship in a supportive academic learning environment that's committed to excellence in family-centered clinical care, research, and advocacy. And I think that this speaks to several aspects of our program that really make it an exciting and unique place to train. First, we value the opportunity to train at a hospital within a hospital model, which allows us to really care for children across the continuum of their own lives. For example, a child with Down syndrome or a child with autism or cystic fibrosis can be cared for throughout his or her life within the Mass General system. And it really sort of facilitates that smooth transition of care that happens as children approach adulthood. Additionally, the opportunity to care for an entire family is important to us. For example, as a level 1 trauma center, for a family who unfortunately is involved in something like a car accident, the entire family can be cared for under one roof. And in my own day-to-day clinical practice, this really plays out, for example, in the collaboration that happens with our maternal fetal medicine and obstetric and gynecology colleagues for a mother who has complex medical needs of her own, or a neonate with congenital anomalies that requires sort of multidisciplinary, highly trained, high subspecialty care really allows us to be able to care both for mom and baby. I think one of the second things that sort of speaks to the richness of our program is the opportunity to train trainees in a way that is personalized to your own educational experiences and the mentorship to meet your learning needs and your career goals at the end of the day. And that we really want to get to know our residents as individuals, and the size of our program allows us to do that within the framework of ACGME requirements. Several years ago, we had discussions about creating tracks within the program, and our residents, sort of based on feedback, had sort of clear desire that we continue to not track our residents specifically, but that has really sort of facilitated flexibility in the training. In the end, about 40% of our residents pursue careers in primary care, and 60% of our residents pursue fellowship training, including now that Pediatric Hospitalist Medicine falls in that category. And then finally, with respect to research and advocacy and the broader lens of scholarship, that's really an important piece of our identity as a residency program. And we want and encourage our trainees to take advantage of all of the opportunities of the MassGeneral system, the medical school, the School of Public Health, as well as Boston at large. We think it's an incredibly rich learning environment, and we really want you to take advantage of all of those opportunities, finding the right mentors, the right experiences that will really inform your career. With respect to advocacy, our trainees are actively involved in the MassGeneral Center for Gun Violence Prevention, as well as Residents and Fellows Day at the State House, which is an opportunity for residents and fellows across Massachusetts to come together and develop some of those skills around advocacy and legislation that really have a meaningful impact on our patients, their families, and their communities. I think at the end of the day, one of the things for me personally that makes MassGeneral such a unique and incredibly special trainer are the people. And I hope that whenever you're sort of talking to residency program leaders, that's the sense that you get from them as you're learning about programs, is just that I am grateful every day for the compassionate and dedicated multidisciplinary team members that I get to work with when I'm caring for a sick child and a worried family. And that I hope over the course of the next hour that we're able to convey for you a little bit of the sense of the community for the training programs here in Boston.
Thank you, Kate, for that introduction of your program. So I just want to jump right into questions. And so Ted, I'll go to you first. Can you give us an overview of the timeline for this year's ERAS application season? And also, how are you preparing for this application season as it's different than years prior? Ted, you're muted again.
Applicants this year are going to be able to submit their applications on ERAS as of September 1st. Programs can start to review those applications on September 29th. And the shift a little bit later in this whole season has remained this year, so that the rank order list deadline for both programs and applicants is going to be March 2nd, and match day is March 18th. We still don't know whether we're going to be recommended from our national organizations to go virtual, or whether it's going to be a hybrid or an in-person model, but we're going to adapt to that. So I think that we have a slightly shorter time frame over which we can review applications, but what we've set up on our end, and I'm sure other programs are doing the same, we have a good amount of readers of these applications so that we can get through it in a more compressed time frame. But just to reassure you, we're going to read your applications from cover to cover. We do that with all of it as part of our holistic review, and we'll really give your applications a thorough review.
You know, I think it's interesting because we've talked about the shifts in the applications. Obviously, last year was an anomaly, but there definitely are some carryovers that are happening, with dean's letters actually coming in sort of the same time we're able to review applications, as opposed to before it was we would get part of the application and then the MSPE or the dean's letter would come towards the end of September, beginning of October. So they're definitely trying to make sure that the entire application is there. And I really think it's important for students to be aware of this timeline, because it may impact how we're reviewing your application, given that we're getting it all together. And so I want to turn to you, Kate, just to carry on with this discussion. Given the uncertainty about the application season, what are your recommendations for students as they go into this process?
Thanks, Alden. I just want to touch on the point that you just made. I think that's a really important one, that where we actually waited to start our review of applications until Dean's letters were available, because we felt like that's such a core piece of applications and being able to holistically review applicants. And so I agree. I think that's a really important point that both Ted and Alden that you've made. With respect to sort of, again, some uncertainty around what this application season will hold, I think we would encourage you really just to take a breath and relax. You know, that there was much more uncertainty, I think, around this last application cycle, and programs are really almost scrambling to sort of put together videos and highlights and ways so that applicants could get to know our programs virtually, since we weren't able to do that in person. And so I think approaching this next application cycle, that take advantage of some of those resources that are now out there that weren't there previously. And that I think that just knowing that the program and the application process worked this last time, there's still a little bit of uncertainty whether this next season will be in person or virtual or some hybrid model. Certainly as we get that information, we'll be sharing that with applicants, but that there's great resources that are out there now. And pediatrics was also a field where a lot of applicants were not over applying, which speaks to sort of the sheer number of applications that programs are receiving. I think that that's important too. So I would say use your mentors, use those people who are sort of helping you think about residency training, and things are going to work out just like they're supposed to.
I think you made a lot of great points there. You know, we were, everybody was caught off guard last year, and we as programs were really scrambling to make sure we put together the best setup forward so we can engage trainees, students who we hoped would become our residents. And I think now we have, you know, the lessons learned from last year, but there's still a lot of uncertainty. I mean, we just got the new recommendations about masking or not masking and gathering coming from the CDC, and that's impacting the way states are allowing for group gatherings and whatnot. So we're still in a learning process ourselves. So my recommendation to all the students is understand that programs are still adjusting accordingly, and it's okay that we have a little bit of uncertainty. We're going to do our best to make sure we work it out for you as we go forward. So Ted, I want to turn to you about a discussion we were having before we started this webinar, and something you mentioned in your introduction, talking about away rotations. A number of students are interested in away rotations, but it's a relatively narrow window for students to do so. How will away rotations be viewed this application season from a program director standpoint?
Well, first of all, we know that it's hard to get the schedules to line up. So don't dismay if you can't get an away rotation. That being said, they're very valuable for you. You get to know a program much better than a one-day interview day or a Zoom call. So if you can secure one, that's great. But we realize it's not possible for all the places you're interested in. Even though the applications, the programs start reviewing applications in late September, we're still accepting letters that come in after that date. So that if you have a visiting rotation that happens in October or November or even December or January, those still count. And so that even though that window in the summertime and September seems to be prime time, we still accept. What you do is your application is in, let the program know another letter has just been submitted to ERIS. And that way we can download that and review it. As long as all the information is there before the day you interview, you're golden.
And just a shameless plug while we're here, we're talking about the visiting clerkship program. It is, we are going to be hosting students from August through November. That's when the visiting clerkship program will be in existence. Students are still able to rotate any other times, but the resources that we put forward as part of the visiting clerkship program will be available for students during that time. And we'll have some more information available towards the end about how you can find out more about that amazing program. So Kate, turning to you, if a student isn't able to secure that rotation, even in that extended window that Ted was talking about, what should they do? And how will students who are unable to do those away rotations be compared to those students who did away rotations with us?
I think that's an important question. So I think even, again, to sort of touch on the point that Ted just made, is even pre-COVID, the vast majority of our applicants did not do away rotations with us. And that, again, sort of relying, if you're not able to do a visiting rotation, it's totally okay. And that we and other programs have put together lots of information that are available on the websites, again, trying to highlight the culture of the program and the resources that are available to help you make informed decisions. We're hopeful that as we're getting some guidance around whether recruitment will be in person, virtual, or again, sort of a hybrid model of those, we're hopeful to be putting together some virtual workshops for applicants, or at least some drop-in sessions where you might be able to attend some of our didactic conferences, again, to get a little bit of a sense of the program. And that importantly, we do not favor applicants who have done away rotations with us. We know that, as Ted was saying, they're important in that they give you, a little more information in a sense to get to know programs a little more intimately. And we're excited about you getting to know us as well, but they really do not factor into sort of how we're putting our rank list together at the end of the day. They're really meant to be opportunities for you to get to know a program, to learn about the resources and the people and the community that's present.
Great, and I think that's a great segue. You mentioned that you're going to be putting together programs so that students can learn more about residency programs, your residency program. So Ted, if a student has a particular interest in your program, how should they go about letting the program know that they're interested?
Well, it's always fine to express an interest and to actually say why you're interested in our program. Having a link to this area where, let's say your brother or sister was working in Boston, that's a natural link, because we're oftentimes wondering why somebody from the West Coast is going to come to frigid Boston in the Northeast. And knowing your sister's working here, your brother's working here, that's one thing. If there's something about our program that is totally appealing to you, that we want to know that, because when you show up for an interview, we're going to try to make sure that you're interviewing with the right people who can provide you with the information that you need. So, and you may have those preferences expressed to multiple programs because you sincerely have interest in all these different programs, but just be honest about that. It helps us understand you better and make sure that we set up the right interview day for you as well.
That's really helpful. Thank you for that. So, okay, is there value in reaching out to the current residents in a program to learn about your program, or even maybe some faculty that are out there?
Again, sort of going back to the idea behind visiting clerkships, it's really about your experience and meant to be for you and not for the program itself. We would encourage you, absolutely feel free to reach out to any of our applicants, any of our current residents, any former residents, any of our faculty. People are very excited about our program and happy to chat and again, sort of help you make those connections and get to know the program a little bit better. It does not in any way make you more competitive or sort of give you an edge, but it's really about what's meant to be helpful for you. So if there are ways that we can be helpful, if, as Ted said, there are specific areas that you're interested in, if you just have some questions, let us know, and don't hesitate to reach out to myself or our chief residents, and we're happy to sort of help you make those connections.
And, in the past, I've heard, it's really helpful if you have someone from your medical school who is in our program to reach out to them, because they can tell you about that transition period going from being in that one particular medical school to one of our residency programs, or then also just talking to faculty at your own institution who may have trained at one of our institutions, because they can also be a great resource to you and tell you what the differences are between our program and their program. So there's lots of ways to reach out to folks, lots of ways to find out more about our programs. But I would say, and hopefully I'm not overstepping my bounds when I say this, we're pretty welcoming, and we'd love to hear feedback from, or we'd love to get questions from students, because we can really help share more about our programs, and you can get more of a feel for us beyond what you can see on our websites and our social media accounts. So Ted, going back to you, we're thinking about students. They're expressing interest in a program, they're preparing their application, they're getting everything ready for ERAS. But it was a tough year. We had the pandemic, virtual clerkships, timelines were completely thrown off for a lot of students, including their step one timing. How can students set up their application best to maybe overcome a poor performance in a core clerkship, or maybe a weak evaluation, or maybe they didn't do as great as they would like to on step one?
Well, I'll address that. First, let me talk about step one. I am so happy we're no longer going to have scores for step one in the future. It it's been such a high stakes exam. You know, when I was a medical student, none of us ever studied for any of the steps. It was a different era. And our program actually ignores step scores. We have taken residents in our program who have failed multiple steps, but we saw in a holistic review of the application of that student something that we valued. And so we don't put a filter with any of the step scores. We don't have it weighted into our decision. We ignore them. So you can ignore them too. Now let me talk about the clerkship performance. So weak clerkship performance is something that we would pay attention to. I think it's best for you to address that either in your personal statement or on the interview day or both. You know, we understand that sometimes schools have a certain proportion of the clerkship grade be linked to the testing that goes along with that clerkship. We don't always know what that proportion is, so you should help us understand that. But also, if there was something else going on in your life, if it was your first clerkship, listen, we cut people breaks. We really look at the whole of that application and don't take any one element to be the be all and end all. But I think with regard to clerkship performance, because clinical performance is important for residency programs, that you should try to give some sort of an explanation or say, I was just distracted or whatever. One other thing about getting back to the former question, reaching out, our intern selection committee chairs, which are Sam Lux on Boston Children's side and Chris Cheston on Boston Medical Center, are more than happy to answer any of your questions, no matter how many there are. So don't hesitate about reaching out to our selection committee chairs because they're communicating with applicants all the time.
Great, thank you. And Kate, what should a student do if they haven't taken step 2 prior to applying? Should that have an impact on an application? And if so, how will that impact them?
Great question. So again, to go back to the point that Ted just made, we are so excited that the steps are going to pass fail. We think that that's a really important move. And along the same lines, we actually blind all of our application reviewers and interviewers to people's actual step scores. So we have been doing that effectively as well. We understand that with COVID, there have been a lot of challenges when it comes to just the logistics of being able to schedule things and along those lines. So please don't worry about not having taken step 2. We understand that there have been a lot of delays and challenges that have been entirely out of your control. So please don't, let that keep you up at night.
You know, it's interesting, and it's great to have you two just really doubling down on how step 1 is valued or not valued in your review process, because I know a lot of students have angst about that, and I really appreciate you being candid about how you approach this from a applicant review standpoint. And I also just want to echo that, we always talk about holistic review, but it's good to hear that you all are actively engaged in this process and thinking about making sure that you identify students who meet the values of your program as opposed to artificial barriers or metrics or hurdles for them to overcome. So to all the students listening, I think this is just a testament to the quality of the programs that you're hearing from with the 2 amazing representatives from each. So Ted, just another question about the application. Any thoughts on what a student should be putting into their personal statement? And because COVID has been a universal topic and we've all been impacted by this, to what degree should students comment about COVID in their personal statement?
I think just like I mentioned about a weak clerkship performance, if COVID actually provided some sort of a barrier for you to gain access to certain electives that you couldn't pursue, which then would be accompanied by a letter of recommendation, you should let us know about that. Because if you're applying to pediatrics and you only did the core clerkship and nothing else, it was all because of scheduling matters, let us know about that. I would also say that there are very few among us that are really good creative writers. And I would caution against highly creative, eccentric personal statements unless you are doing narrative medicine as a sidebar to your life. There have been some attempts at humor that just fall flat. So I try to be as straightforward and direct and honest as you can. And, you know, talk about what inspires you, what gets you going, what makes you tick. We all know that you've chosen pediatrics for a reason, and you can state that reason, but it's, I don't think I would try to make it into something that should be worthy of, you know, the New Yorker magazine. I'd also be careful about things like spelling and grammar. And so what I urge you to do is have somebody else look at your personal statement. When you're writing something, you sometimes gloss over the same error every time you proofread it. And it just doesn't make you show well because it looks like you might be careless. So I would have a couple of people take a look at it, maybe have your advisor take a look at it, and try not to get too cutesy.
I think that's great advice. I always remind applicants that it is your personal statement. It should be that personal and a statement, and you have to make sure it reflects that. And also, I like to use sort of the bell curve analogy. Sort of 80% of the personal statements sort of fall into, you know, it's a good statement. There's this 10% that really wow us and knock us off our feet. But then there's the other 10% that are like the red flags. And I think you highlighted those red flags when it's bad humor or a story that seems to be wandering and not going anywhere, or it has nothing really in context to the applicant themselves, or it's just so poorly written because there's grammar and punctuation issues. And we in medicine sort of get fixated in those errors and we're like, oh, this is bad, this is bad. And it completely detracts away from everything else that the student may be trying to say.
So true.
Thank you for the amen, Kate. So another part of the application that we should really focus in on is letters of recommendations. So Kate, can you talk about the letters specifically? What should the students, who should they be asking to be a letter writer? And what can they do to help that person write the best letter possible for them?
Yeah, great question. So I think this is something that's worth a little bit of time and a little bit of thought. I think that it's helpful to talk to mentors and potentially, run some thoughts by that person in terms of who you may or may not be asking for a letter of recommendation. At the end of the day, I think it's really important that it is each of your letters writers is someone who knows you well. They need to be able to, and I think that it's useful when you can to even set up a brief meeting with that person, to come in hand with perhaps a draft of your personal statement, with an updated version of your CV. And your letter of recommendation really should not be just a regurgitation of your CV, but should really speak to who you are as a person. And I think it's okay to ask your letter writers to say, I did X or Y rotation with you. Are you comfortable writing a strong letter of recommendation for me? And hopefully that faculty person will be honest and say, yes or no, because I think that's an important ask, that it needs to be, you are asking for a strong letter of recommendation to support your application. So I think that's important. They do not, for us specifically, they certainly do not all need to be in pediatrics. But again, I think it's helpful if it's someone who knows you well. Generally, at a minimum, I think you need 3 letters of recommendation is just fine. You don't feel like you need the 4th and 5th letters and it's not necessarily about the title of the person who's writing your letter either. I think if you have the opportunity, say you're doing an away rotation, or if you're doing a sub-I, it's okay to approach that faculty person beforehand and say, I'm hoping to get a letter out of this rotation. I may be asking you for a letter of recommendation at the end of it. And I think if anything, that maybe primes that faculty person to be mindful while they're on that specific rotation with you, and hopefully then be able to include some concrete examples of your performance in that letter of recommendation, which I think really strengthens a letter of recommendation if faculty are able to specifically comment on some of your, the way the rotation went.
Thank you. And I just want to get one point of clarification from you, Kate. Do you need a chair's letter for pediatrics as part of your application? I know some specialties do require that.
No, we don't. Ted, correct me if I'm wrong, but no, we do not need a letter from the chair.
Yeah. Some specialties do expect to see a letter from a chair.
Not pediatrics.
Good.
Yeah.
And just to follow up on that, you made a great point that I think we need to double down on. We often think that we need to get letters of recommendation from the most senior person, the person who's a full professor, and those letters often come off as generic if you really don't know them, because you're asking them because of their title, but not because of the relationship that you have with them. So as you think about who your letter writers are, make sure that they actually know you, know your interests and the direction you want to go. And I think you made a really good point on really bringing a copy of your personal statement or your application with you to the program or to the letter writer, so they can get a full understanding of who you are as an applicant and why you're applying to pediatrics. So I think those are some points that I really just wanted to pull out as part of this discussion. So we've walked through everything from learning about the program to applying to the program. And now we're at the point where a student may be offered an interview. And Ted, OB residency programs have already committed to virtual interviews this season. Do you think that pediatric programs will do the same this year?
I'm hopeful, but we try to take the guidance from our national organizations. We have the Association of Pediatric Program Directors that's going to come out with a statement of what they expect programs to do, and we're pretty much going to follow what they recommend. I think we're in a different ballgame this year. I think the CDC has changed the landscape, and I'm hopeful that we're going to have some form of either in-person or hybrid interviews. Frankly, I was pleased last year, not only for the safety of all the applicants, but the reduction of costs of all the expenses related to interviews. And I would love to see a hybrid model be employed. I could easily see unlinking the interviews being live from the visiting of the program. And that would probably reduce the cost, because people could go in some sort of a multi-site trip across the country in a couple of loops and see all the programs, but not have to be constrained by when the interview was. My selection committee chair desperately wants it all to be live. And the advantages for programs is that you get to meet us in person. And frankly, the interviews count less than you getting to know our residents when you come and visit. So however we can do that, I'm keeping my fingers crossed. I'm hopeful we're going to know before you start submitting your applications. I think we should be able to get this figured out within the next month or two. But there hasn't been any word, and I looked just recently and I still don't see anything. Kate, have you heard anything?
No, I haven't, not yet.
And again, I think this just goes to show that program directors don't have any more heads up than students in this process, and we're all waiting to find out what our process is going to be. So we're waiting with bated breath, just like you are. And it also goes to show that we do really want to meet you, but we recognize that there are pros and cons to the virtual space, whether it's the cost that Ted was mentioning, or just the ability for us to interact with students from all across the country who may not have applied to us in years past. But there's a strong chance that there may be some component of this that is virtual. So Kate, how do you advise students to shine during this virtual interview season, if that is the case?
Mm-hmm. I think, again, a little bit of preparation goes a long way. So taking the time to make sure that you have, backup power, that your computer is hooked up and ready to go, finding a quiet space to do so, making sure that you have contact and phone numbers. Things inevitably will happen. And so I think, again, sort of being flexible. We're nervous too about the whole sort of virtual interviewing thing, and things happen inevitably. Our children walk in, and so I think everyone has been very understanding that it is just the nature of the Zoom world that we're living in, but taking a little bit of time to make sure that the lighting and the background and all of those things that are readily available to you, and then just being prepared and being yourself. And I think that you're making the best of it.
Yeah, and there's some great resources that are out there. I think the AAMC has a really good guide for preparing for virtual interviews. It doesn't hurt to practice, and as Kate mentioned, just be prepared for the unexpected. So, you know, if your computer is acting up or your Wi-Fi goes down, think about what your backup plan would be in order to make sure that you're able to participate, and then also communicate with us, because we know that the virtual space is not perfect. So I actually, you know, we're going through these questions, but I actually wanted to just take a step back because I have a different question, and I'll toss it to both you, Ted, and to you, Kate. You know, last year, the big concern was that we were going to have more students applying because of the uncertainty. And I do think that we saw higher numbers of applicants for residency programs. You know, students were over applying. How do you encourage students to really be thoughtful in the number of programs that they apply to, so that they aren't just casting a net, running up a cost for themselves, especially if it's not necessarily in a program that they're truly interested in? How do you encourage students to sort of narrow down that process and really think about the right number of programs to apply to? So I'll go to you, Ted, first, and then I'll go back to you, Kate.
Yeah, I think that you need to be talking over with your advisor, somebody who can be objective, evaluating the strength of your application and helping you narrow it down to about 10 schools, 10 programs, maybe 12. I don't think any more than that, because I just want you to imagine if you applied to 50 and they were all in person, is that even feasible? I think get about 10 or 12. Think about some reach programs, think about some middle, and think about some safe programs. I think that's the way to strategize. It's like a balanced portfolio of anything. And then only go to places where you want to go. Only visit places where you could see yourself living. And think about those other factors that drive that. People that you know there, areas of the country, other connections that you have, features of the program. You know, we've got enough residency programs in pediatrics that you can find 10 or 12 really comfortable places where you could get great training. And so just be aware that you can't go everywhere. You know, when you come to a fork in the road, you take it. That's what the best advice is. And don't overreach.
Kate, anything to add?
Absolutely. Ted, I completely agree with everything that you said, and sort of that, since you're interested in programs, that geographically that has to be a consideration. And I think too, what you touched on is residency is challenging. It's stressful. It's a lot of hard work. And those things that are important to you in your life, if it's family, friends, the sort of connections around you, those things only become more important during residency training as you're sort of going through this very intense period in your life. And so I would encourage you just to be mindful of those things and recognize that they will continue to be very important during residency training. So just making sure that you continue to have those supports in place, and that geographically that places make sense for you.
Yeah, wonderful. And this sort of just is in line with the question we were just talking about. Going to you, Ted, what should students consider when they're creating their rank list? You know, they've done the interviews, they're putting together their rank list in February. How should they go about putting that list together?
I always, you know, sometimes people know exactly the order they want to put them in, and I would put them in that order. I would not be inhibited about putting the program first, not putting it first because you think you're not going to get in there. Because surprises happen. You don't really know how you were looked at by that program. If you don't know which order they should be in, I would suggest going to somebody who cares about you and you telling a story about each program. And whether you know it or not, you will, with your intonations, your sense of enthusiasm, your body language, you will convey what your rank order list is to that other person, and then put it down that way. And I think don't vacillate, make a decision and be done with it. I think that's the best way. I think the statistic is that 80% of pediatric applicants from US medical schools get their first choice. So it's pretty likely that you're going to go where you're going to want to go. We're not in a situation like some of the most highly competitive specialties where it's a shot in the dark. So when you do your rank list, be certain and have it affirmed by somebody who knows you, and then you're going to be fine.
You know, I think that's an interesting stat, and I like the direct approach to this. We all have that gut feeling when we walk out of an interview of like, wow, that place, that was it. And so just remember those little things, because, you know, we may go through and do all these complicated spreadsheets and ranking and numbers and all that. But, you know, you have that internal sort of gut feeling that you should also make sure you pay attention to. Kate, I want to talk a little bit in a different space. We've been talking about the application process a lot, but I think there's other components to residency programs that we need to talk about. As we discuss physician wellness and residency burnout, what is your program to support trainees to address issues around burnout?
I think this has been particularly sort of brought to light this year as we have been, or I guess now for the last 15 months as we have been dealing with COVID. One of the things that we tell our residents is the importance of not worrying alone, that we really are a sense of community, that we're there for one another, and that we never want you to be sort of alone with a worry and not feel like you have somewhere to turn. So I think at the end of the day, that's really something that we stress for our trainees and that we take to heart for ourselves. And we want to make sure that people know that there are resources there. I think for us, there are quite a number of sort of residency-sponsored sort of resources, as well as things on the institutional level, like the Employee Assistance Program has now a dedicated trainee assistance program that is specifically for trainees. And I think, you know, with all of the challenges of COVID, that there has been greater utilization of Zoom for mental health resources as well, that have, for all of the challenges that trainees face in terms of accessibility of mental health and resources that are available just based on your schedules as a trainee. I think that this has actually been a great innovation in terms of the availability now of those resources, the attention that institutions are paying to them, and how important they really are. You know, and not just mental health resources, but things like the gym number. I think both of our institutions have resources and accessibility to some of those types of things as well, just paying attention to your own physical health as well. And so I think one of the innovations that we made this year is on ambulatory rotation, that we have created half days that we're just calling wellness days, that are meant to be days really where you can, you know, find the time to schedule a doctor's appointment or a dentist appointment and have that built into your schedule. So there is some regular 9 to 5 availability for you to do those types of things and take care of yourself. So I think that paying attention to some of those things as you're thinking about residency training is important, and that an institution is thinking about you and your wellness, and recognizing that that how important those things really are in terms of your well-being and the longevity, or, you know, establishing those careers during residency training, or I'm sorry, establishing those habits and that attention to your own well-being and your health, right? We have 30-plus-year careers ahead of us as you're finishing training, and being able to really establish the importance of those things and taking care of yourself. This cliche, right, is that taking care of yourself allows you to take better care of your patients too. But I think it is so important, and I'm glad to see that if one of the things that comes out of COVID is just how important that truly is.
Thank you. And Ted, can you talk about the culture of Boston? Specifically, how have your trainees who are underrepresented, coming from underrepresented medicine backgrounds, reported their experiences living here? And I'll just give the caveat, you know, Boston has a reputation of being a city that is not welcoming to minorities and being racist. And I personally can say that that has not been my experience here, but I would love to hear what your trainees are reporting to you as their experiences here.
Sure. And again, my perspective as an older white man can't be the information that you base your decisions on. That's why we have our diversity council make a connection with you as underrepresented in medicine in the application process, and will be your constant contact throughout the process. so that you can really explore this area and make a decision for yourself. There is a resource to just look at the history of Boston. The Boston Globe, I think, had a 9-part series that they did about 5 or 6 years ago that you can find, and probably by Googling it, and just read the history. But we all remember what happened with the busing at the time and the violence that was going on and the racism in Boston. From my perspective, I think Boston has come a long way. From the perspectives of my diverse residents, they enjoy living here, and many of them stay. And I want, when you apply to our program in pediatrics, to hear it from them. My perspective is a little bit different, thinking about not just underrepresented in medicine, but the demographics of Boston. If you're a single person, guess what the largest demographic is in the city of Boston? It's between 25 and 40. So if you're single, you may not remain single for very long because there are a lot of people that you can meet. I think of Boston as what a Fast Company magazine called the smartest city on earth. And it's because we are so enriched by people from all different backgrounds, from all different educational institutions, startup companies. Moderna was founded by 2 physicians from Boston Children's. We've got the biotech industry is here, financial institutions, insurance, higher institutions, the hospitals. There are more doctors per square mile than any other place you can imagine on earth. And so Boston, to me, is this intellectual hub with lots of opportunities for young people. Boston is a walking city. Our hospitals are easily accessible without a car. You can live without the costs of a car in Boston, which I think are very important. And I think there are just endless opportunities for sports, culture, intellectual pursuits. But you have to bring a heavy coat and boots because in the wintertime, it's frightfully cold. And it doesn't, the spring seems short, but the summers are perfect. So that's my perspective, but we will give you the perspective of the comfort that you'll feel living here from people on our diversity council.
And I would just say this, reputations die hard, and I think Boston has suffered from a deserved reputation in the past because of its experiences and how it's dealt with race. But it's a much different city than what you will hear, what you'll hear about. So come and visit us, learn about our city, talk to our trainees, and get their perspective as individuals who are here and living and working in our hospitals, because it may be very different than what the rumors are about our city. Kate, one more question. Can you share your thoughts about the relationships between the Harvard teaching hospitals? We have so many, right? We have multiple residency programs for pediatrics. We have multiple hospitals across Boston and Cambridge and reaching out to our other suburbs around the city. Can you talk about just overall relationship, and is it a cordial one between the hospitals?
Yeah, I think that's it's an important question, and one that we often talk about during recruitment in the recruitment season. If people wouldn't mind my sharing just a little bit of my own personal experience. So I actually did my residency training in the Boston Combined program, a chief year over at Boston Medical Center. The neonatology fellowship program that I did, it's a combined fellowship program. So I actually worked at Beth Israel Deaconess, MassGeneral, Brigham and Women's, and Children's. And so I've been tremendously fortunate in my training now to have worked at many of the institutions that are here in Boston. And I have to say, coming from the Midwest, not having spent much time in Boston, not knowing the area particularly well, that was something that I did worry about. And then I did feel a sense of imposter syndrome, that a little bit of just uncertainty about my place and fitting in, touching a little bit about on, what Ted was just talking about. But I have to say that I have been amazed at each of the institutions where I have functioned, that they are incredibly welcoming, open places. People are excited about you as an individual, excited about what you bring, your experiences, your interests, and really, I think that we many of us stay in academic medicine because we enjoy the opportunity to work with trainees and help you on sort of the next steps in your training and in your career. That it's something that many of us are passionate about. And to be honest, many of us, pediatrics is not a terribly large field. Many of us have worked together and trained together, and Boston is also not a terribly large city. So I think that there are great relationships between institutions. And at the end of the day, we really want what's best for our patients, their families, their communities, and one another as sort of trainees and colleagues. And so I think really taking advantage. We're very sincere, both of the BCRP, I can speak to my personal experience, and MassGeneral for Children, is that we want the best for you as a trainee. We had talked a little bit about finding the right fit, and we're very sincere about that. So at the end of the day, you're going to get amazing training at any number of institutions, but really it's about the fit and hanging on to that gut feeling that we were talking about.
So we're coming up towards the end of our time, and I want to take one or two questions from the audience. So Ted, I'll go to you with this question. What do your residents do after residency? Where are they staying in Boston? Are they doing fellowships? What are your trainees going to do after residency with you?
The vast majority of our residents subspecialize, and the majority of those who do fellowships, whether it's hospital medicine or subspecialty, stay in Boston. We've calculated that 80 to 90% of our residents remain in academic medicine in some way, shape, or form. The one thing that's been a surprise is we're swinging back into primary care, and a greater proportion are going into practice, populating the practices within our hospitals or within the private practices around Boston. But I think that it's true that once people come here, they tend to stay, except for one group. Those are the people from Texas. Texans always return to Texas eventually. It's that libertarian attitude that they love so much.
I love it. As a Texan, I hear my state calling me, so. All right, and for you, Kate, quick question. Well, probably not a quick question, but hopefully you can answer this succinctly. Students are interested in how they can be working in advocacy work, caring for underserved communities. How can students both express that interest and then use that time in residency to engage those communities that they may be coming from, or that they're interested in serving, particularly underserved communities?
Absolutely. I think I will try and be succinct. I think one of the best examples of that is our continuity clinic experience. We don't have a single sort of resident continuity clinic, but really we utilize, currently we're have residents in about 16 different locations. And from the day after that you match with us, we'll solicit information for you about what experience are you looking for in your continuity clinic experience. Would you like to be working in a community health center? Are you interested in more of a private practice model? Is there a particular subset of patients that you're interested in caring for? Do you speak Spanish and have a different language skill and would be interested in utilizing those skills in the patients that you're caring for? So I think that's one of the most obvious places where we are really interested in, again, sort of individualizing your experience, matching you with some of those goals and interests and communities that you're interested in serving. One of our residents actually grew up here in the Boston area and then went back to the primary care practice where she was cared for as a child. And that was a really meaningful experience for her. So we really do look to match you to take advantage of that. And then as you move through residency, really taking advantage of some of those other advocacy and community experiences.
Awesome. And just we're going to go ahead and wrap this up now, and I'll go to the same question for both Ted and Kate. Any final words, any words of wisdom, piece of advice for students as we close? Ted, you go first.
Well, I think that just thinking about your career decision, if you're not completely sold on pediatrics, I'll tell you how I think most people make the decision. They either make the decision based on the patients, the diseases, or the colleagues. For me, I was on the fence between pediatrics and surgery, and it was because I love surgeons. I love the way they move and think and make decisions and take the patient to the OR. But I really had to admit that I loved kids more, and I wanted to be caring for kids, And I thought that their range of diseases were quite broad. I was actually in private practice for 13 years before I re-entered academic medicine. So think about that. What really drives you? Is it the colleagues and the collegial interactions, the fascinating disease processes that you would like to solve and cure? Or is it the patients that you want to take care of and your feeling of wanting to take care of that age patient population?
And same question you take.
Ted, I think that's some really important points that you make. And I think especially given where we are as sort of a society at the moment with all of the uncertainty around COVID and all the changes that have been made, we're really excited that you're considering a career in pediatrics, that there really there's so much to be done in terms of advocating for patients and their families and the communities, and that really as a pediatrician you have a voice to be able to advocate for the children of our communities, that it is such a privileged position to be in, to care for children and their families as sort of the future. And so we are thrilled to that you're interested in that career. And just as Ted was saying earlier, please don't hesitate to reach out to any of us if we can answer any additional questions or be helpful in any way.
Wonderful. And so I just want to go ahead and say thank you to our panelists, Dr. Sparger and Dr. Sectish, for joining us. This was a great, enriching discussion. I learned a lot, and I think there's a lot of great take-homes for our students who are interested in the pediatric residency programs here, both at Boston Children's with the combined residency program, as well as Massachusetts General Hospital for Children. Just a couple other announcements. We have a few events that are going to be happening here. You can take a look. People were asking about contact information for our residency programs, and we'll be sure to share that and post that. This recording will also be posted, and so if you have any things that you want to go back and listen to again, we'll be sure to put that up in the next week or two. And there is a quick poll. If you could just click through, we would really appreciate it. It gives us more feedback and helps us tailor some of the way we structure these events going forward. And lastly, I just want to say thank you again to Dr. Reed for her leadership in the DICP. I want to say thank you to Jasmine, who's been organizing this behind the scenes and helping us to have a smooth conversation. And again, to our two residency directors for being here and sharing their expertise. We have a few other programs coming up in our series talking about surgery, emergency medicine, and psychiatry, as well as a few other specialties that we'll be touching on during the month of August. To all the students listening in, good luck on the application process, and we hope to see you for your interviews, either in person or virtually, and hopefully have you here for away rotation and to have you to match with us for your training. Everyone have a good rest of your day. Take care.